Antrim County is a passionate community filled with over 2,000 veterans. Antrim County Veterans Affairs promises to keep the military tradition of caring for our brothers and sisters alive. We at ACVA thank you for your service and are proud for the opportunity to serve our county's veterans. And now for our featured presentation.
Hi again, I'm Libby from Antrim County Veterans Affairs, and today we're going to talk about VA healthcare, Tricare, and CHAMP VA. We had a lot of questions about that, so I know a lot of people don't get much information on it, and if you Google it, you get inundated with too much information, so we're going to try to keep this simple and concise, and then if you have further questions after that, you can call us or go online. So VA healthcare is for veterans who served active duty in any military, naval, or air service. You can be in the Reserves or National Guard and have a discharge other than dishonorable. After that, your eligibility is based on when you enlisted. So this is going to be back to 1980, if anybody goes back that far. If you enlisted after 1980, September 7th to be exact, or after October 16th, 1981, you would have had to serve 2 years consecutively. Or if you were in the Guard or Reserves, you would have to be called up to activation there, or federal orders, and completed that period that you were in to be eligible. So let's say you're eligible, you meet the eligibility requirements for VA healthcare. What they will then do, and how we would help you here at the office, would be to fill out a 1010 EZ for enrollment into VA healthcare. That will be determined by your military service history, your disability rating, your income level, whether or not you qualify for Medicaid, and other benefits that you might be receiving, like VA pension benefits. So if you have a disability rating between 10 and 40%, then you have copays, and that would be in priority groups 2, 3, and 4. And then if you have a 50% or over disability rating, you will be in priority group 1 and no copays. Below that, in priority groups 5, 6, 7, and 8, that'll be based on your income level, and then that will determine your copays on which category level you're in, or priority group. So, service-connected disabilities put you in a higher priority group. If you qualify for more than one priority group, then they'll put you in the highest one. So, 1 being the highest, they would put you in that. So again, our office can help you fill out the form, the 1010 EZ, to enroll in VA healthcare. We will fax it to the VA, and they will determine what priority group you're in based on the information that we give them. Does anybody know what CHAMP VA stands for? So next we're going to talk about CHAMP VA, which is the Civilian Health and Medical Program of the Department of Veteran Affairs. It is for the civilian, which would include the spouse or child of a veteran who's been rated permanently and totally disabled for a service-connected disability, or you're the surviving spouse or a child of a veteran who died from a VA-rated service-connected disability, or you're the surviving spouse or child of a veteran who was, at the time of death, rated permanently and totally disabled from a service-connected disability. So there's a common denominator there of the veteran with a service-connected disability, and possibly who died from that. So the last category for CHAMP VA eligibility is if you are the surviving spouse or child of a service member who died in the line of duty. But in most cases, you would be eligible for Tricare and not CHAMP VA. So that's something to look at. And that's a good segue into the next category, which is Tricare, and Tricare for life. To be eligible for Tricare, you need to be a retiree, on active duty, a Guard or Reserve member. It's for survivors, former spouses, Medal of Honor recipients and their families, and others registered in DEERS, the Defense Enrollment Eligibility Reporting System, which pertains to that last category in CHAMP VA, where if you were the surviving spouse or child of a service member who died in the line of duty, you would still be enrolled in DEERS. So that would make you eligible for Tricare. And if you need help figuring out if you're enrolled in DEERS still or not, or if you need to be, or if you need to update your DEERS status, you can call 1-800-538-9552 or go online to tricare.mil you can do that online as well. Now, if you were on Tricare and you reach the age of 65, you will automatically be enrolled in Tricare for Life, which is, let's say, a Medicare wraparound coverage for Tricare eligible beneficiaries who have Medicare Part A and B. So if you have opted in to Medicare Part A and B and you had Tricare before you turn 65, you will have Tricare and Medicare at the same time. So Tricare for Life, let me clarify that. So if you're paying for Tricare and then you transition to Tricare for Life, you would have to check and see if there was a change in the annual premium to stay on Tricare for Life. It does happen automatically, the enrollment does. So you would want to check and make sure that that premium didn't change as well with that. And you can do that by calling Tricare or going online to tricare.mil. Okay, so some of the questions we get about Tricare for Life and Medicare is the coverage. If you went to go see your doctor, which comes first? Tricare, Medicare, who covers what? So I have a handy table here. I'll just go through this. So the type of service, let's say you have, you are covered by Tricare and Medicare. Okay. Medicare would pay their authorized amount. Tricare would pay the remaining amount, and you would pay nothing. Some services are not covered by Medicare, but they are by Tricare. Obviously, Medicare would pay nothing. Tricare would pay their allowable amount, and then you would end up paying your Tricare deductible and cost share. So in most cases, I know Tricare will send out an EOB, an estimate or explanation of benefits, and it will list the services that are covered by Medicare and Tricare, what you are then responsible for. It's pretty clear. If you ever need help deciphering some of those papers that you get in the mail, you can bring them on to our office and we can help you figure out what your coverage is, what you're owing to Medicare or Tricare or nothing at all. If the service that you're getting isn't covered by Tricare or Medicare, obviously you're going to be responsible for the services that you received, and you will be billed for those from the office that you went to for that service. And that may exceed the Medicare and or Tricare allowable amount. So you want to make sure, really in this instance, that services that you're getting are covered by Tricare and Medicare. And if they're not, I'm not entirely sure what that situation would be, but I would call Tricare and or Medicare just to make sure that, you know, that procedure or something like that is covered by them before you get it. Yeah. So again, if you have any questions on Tricare or Tricare for Life, you can go to tricare.mil. They have several different pathways you can go on there for eligibility and different types of coverage. CHAMP VA, again, you can go to va.gov for that, and VA healthcare eligibility. Again, va.gov, that is your go-to spot if you want to go online. Otherwise, you can come to our office at Antrim County Veterans Affairs, and we would love to help you figure out all this healthcare information. Thank you.